number one, because we need a healthy soil to make babies.
Absolutely. Nutrition is the foundation of it. Everything else. Everything else is on top of it.
So, Dr. Bentov, we are so super excited to have you here because, well, about 4 or 5 years ago, I interviewed you with regards to metformin. And you know what, to this day, a lot of fertility clinics are still using it for PCOS and maybe even some other things. And we really want to do a deep dive on this. And before we continue, I think we need to basically share with everyone who you are. Like Dr. Tanya and I love who you are and what you stand for. And so, first of all, thank you so much for being here with us. And it was a complete last minute thing. And you just popped on. And that's just a testament to who you are as a human being, want to contribute to all the women and couples that are trying to conceive and having issues. So thank you for being here.
Thank you. It's my pleasure.
So we know Dr. Yaakov Bentov because he used to be in Toronto, and we are sad because he has left and he is now in Israel, where he is at the Hadassah Medical Center for IVF in Northern Jerusalem. And he also does research with the Hebrew University. And as well, he's currently developing a whole bunch of medical devices for infertility. So we are super lucky to have him here on his time because we called him last minute. Let's kind of go back to like why people are using it. Well, actually, what is metformin? Why we're using it for fertility still, and what your thoughts are around it.
Sure. So it's actually an interesting story. Metformin was used back in the Middle Ages already. It was used as an extract of the French lilac, which is a nice tree with purple flowers. And back in the days, people with diabetes knew that if they extract the leaves and flowers of that tree, that can help them with diabetes. So that was a known fact. And 1927, if I remember correctly, was the first use of the extract of that tree that we use now, we call now metformin. It took a while. I think 1947 was the first time when it entered clinical practice. And it was a revolution in the treatment of metformin, diabetes. Because it was a treatment that was oral, unlike the insulin, which it still is an injection. It helped with type 2 diabetes, which right now and still is the leading medication to treat type 2 diabetes. But because of the fact that it's relatively safe, unlike other diabetes medicine, it doesn't cause hypoglycemia. It's considered to be a safe medicine. People started, and because it was so cheap and available, people started looking for other indications to treat with metformin. And at some point, metformin, I think 2000 was the first paper where they actually suggested to use metformin to treat patients with polycystic ovarian syndrome. However, the fact that people are now overlooking is that the initial intention was to treat patients with PCOS that had insulin resistance. And that makes sense, because if you have insulin resistance, metformin could at some point assist in some way. I don't think it's a good way. I think it's actually it in the long run can do more damage than benefit. However, there was a rationale to use it as an add-on to the regular treatment that we currently practice with. But over the years, it became something that became a treatment of its own to PCOS. And when I was in Canada, and fortunately not so much in Israel, I saw patients with a BMI of 19 or 17 that were put on metformin, which, I mean, that is mind-boggling. Why would you do such a thing? I mean, metformin is not innocent. It has a ton of side effects. People on it, they experience horrible GI issues with nausea and sometimes vomiting and diarrhea, which is quite common. And it's not fun and definitely not helpful. I mean, there's no proof that it does anything, absolutely anything to assist patients with PCOS that don't have insulin resistance.
So meaning what you're saying is there's no good evidence, no research that really proves that is beneficial to use metformin for fertility with PCOS.
Or for women like myself with lean polycystic ovary syndrome or no evidence of insulin resistance, it wouldn't make sense. Is that what you're saying?
Absolutely.
Right.
And the exciting thing about it is we've been using it forever. And only in 2016, there was a paper that published in Nature and explained how metformin works. I mean, we know how a very, very common medication that we're all using for many years was working, and now we know. So the way metformin works, it works by actually poisoning our mitochondria. So what they do is basically, let's go back to the basics. Mitochondria is the engine in the cell that makes energy. So all of our cells have mitochondria, and mitochondria take the sugars that we eat and the fatty acids that we eat and the proteins that we eat, which go into the Krebs cycle. I'm sure you mentioned it in one of your podcasts, at least. This is how the nutrients that we consume are transformed into energy. The citric acid or Krebs cycle produces energy, electrons which have a lot of energy in them, which are part of proteins that can migrate this energy into the electron transport chain that is in the membrane of the mitochondria. And then what needs to happen, those electrons need to kind of jump from one part of this electron transport chain to another. There's 5 components to it altogether. And as they jump, they provide energy for the mitochondria to push protons of hydrogen into a very, very tiny space between the 2 membranes that eventually creates such a gradient that it eventually flows back through the 5th component of the mitochondria. And that makes ATP, which is the currency, the energy currency of the cells. This is what makes everything run. This is our fuel. So an efficient mitochondria is excellent because it makes a lot of energy and it doesn't make a lot of free oxygen radicals, which is the byproduct of the way that mitochondria works. Now, if you think about it, the mitochondria as an engine of a car, as it's a new car with an efficient engine, makes a lot of energy, not too much smoke. An old engine would make not so much energy, a lot of smoke. So efficient mitochondria would work like an efficient new engine of a car. What metformin does, it makes a good engine into a bad engine. So mitochondria does not allow ATP production to run smoothly because it blocks the electrons from jumping from one component to the other, from component number 1 to number 3, component number 2 to number 3, because it deactivates something called the Q cycle, which I think we talked about together a while ago, which is made from a substance called coenzyme Q10, which is my favorite topic of all.
We'll do that another time, for sure. And before you continue, to sum it up, guys, because a lot of us may not have the science background that is listening or viewing. So basically, it just sucks your energy.
and mitochondria, these little powerhouse cells, there's lots of them in the ovaries. So that can be a concern if it's blocking the mechanism to generate ATP. Is that what you're saying?
Heard the punchline. Wait.
What's that?
It's not just reducing the amount of energy that the mitochondria make, but also because the electrons get stuck in component number 1, it turns into ROS, so free oxygen radicals.
Right.
So almost like it could damage egg quality. Like, has that been?
Absolutely.
Yes. So I remember in our past interview, and by the way, we'll put it in the show notes of one of the interviews that we did, because you compared metformin to cyanide. So I'd love for you to explain that.
So it's the same. I mean, cyanide does not allow the cell to make energy by suffocating the mitochondria. It does so in the same manner, but more mildly. So that's the difference.
Yeah.
And
so crazy.
For many, many different indications, including diabetes, and preventing OHSS in patients which are undergoing IVF is exactly because of the way it works. Anything that depends on ATP to happen, if you have less ATP, sorry, it's my cat again, would happen less efficiently if you have metformin in the system.
So how would that be beneficial for diabetes?
For instance, diabetes is caused by a lot of sugar in our bodies. So the more sugar you have, the higher is your hyperglycemia, which essentially is what we use to define diabetes. Sugar comes from our food, but also comes from our bodies. Sugar is being made. So if you think about it, if you eat a cake or a sandwich, it's going to get absorbed and provide flow current of glucose into your bloodstream for about 90 minutes. Afterwards, sugar needs to come from somewhere. So glycogen stores are in our cells are used for another 90 minutes. Then afterwards, it's all about the liver making sugar from proteins. This is called gluconeogenesis. So this liver takes two types of amino acids and it makes sugar out of them. And to do that, it needs energy. So if you have less energy, you would make less sugar. And this is how metformin works. So it lowers the production of glucose by the liver. It doesn't do anything else. It doesn't improve insulin sensitivity. This is all misunderstanding.
Right. Big misunderstanding. So it helps women perhaps with obviously polycystic ovary syndrome if they have the insulin resistance, might help them ovulate by literally helping them not have higher blood sugars because of that mechanism of action. But a woman they've extrapolated that and then said, well, all women with PCOS might benefit from metformin, which is inaccurate. How about in men? There was like research that showed that the use of metformin may affect sperm development in a way that increases birth defects in their sons. Do you know about that?
Yeah, I haven't heard about that specific study, but I totally understand why it would do so.
Yeah, it was newer, maybe. Well, I'll send you the link after. It's kind of fascinating.
Yeah, we can do another talk on that, but let's refocus here.
Sure.
So with the metformin, so here's the thing, right? Like, so doctors still often use it no matter what the BMI with PCOS. So how do you work? Are you using metformin with people with a higher BMI with insulin resistance? Are you still looking at lifestyle and dietary habits?
Well, I don't use metformin at all.
Exactly. So this is exactly where I want to go. So tell us about that.
I use self-discipline. Patients need to lose weight. That's the right way of doing it.
Yeah.
As I mentioned, metformin, it's like a Band-Aid because it makes things look better because of the way it works, but it actually does, in the long run, it does some damage. If you think about it, metformin was shown to reduce weight, yes, but the weight it reduces is the lean body mass. So it reduces muscle mass, which is the only part in our body that actually consumes sugar.
Right.
Yeah, that blew me away watching episode 111 of Fertility Talks, you guys talking about that. I had no idea. It basically causes you to drop muscle mass.
Yeah.
So you're losing weight, but not for the right reason.
Right.
So as you say this, I'm sensitive to women with higher BMI. And this is not about body shaming in any way. And we're just literally coming at it from a point of view of health. How are you feeling in your body? And, what is your fertility level in the moment? And are there things that you can do in your lifestyle to help it? Because it's not necessarily becoming that skinny mini. It's, we see it in research, even like decreasing by 5% really helps with your fertility. Comments, people?
But think about it. The goal at the end of the day is not just getting them pregnant, but also making sure the pregnancy is healthy. And if you start the pregnancy with a BMI over 30, 40, the risks to the pregnancy are enormous. Think about gestational diabetes, macrosomia, the risk for a C-section. Even afterwards, if you have a C-section, the risk for having a scar infection or dehiscence. They're enormous, deep vein thrombosis. So there's so many problems. If you can do it before you start the journey, before you get pregnant, and start everything with a normal, healthy body mass, you don't just make getting pregnant easier. You make the pregnancy safer. I think it's worth the investment. People tend to find comfort in calories, especially from the wrong type. But I think with some self-discipline, this is what I was referring to, you might not need us at all. I had a patient when I was in Toronto. It took 6 months. I saw her every 2 weeks. Every 2 weeks, she had to come with a notebook, writing everything she ate, everything, and how much she did. So I was her self-consciousness.
Talk about stellar RE.
That's great.
My goodness. Yeah.
Yeah. It's not about, okay, the tools of, surgery or drugs. It's like, okay, let's actually take charge and take back control of your life and your habits. That's amazing.
Yeah. And she lost the weight. She ovulated. She got pregnant. She had a beautiful pregnancy. She gave birth to a healthy child. No meds, nothing.
That's awesome.
Right.
Yeah.
We see that all the time, and it's amazing to hear it from a reproductive endocrinologist, because I think that sometimes we jump to quick solutions to try to have, more of an aggressive, quick outcome, when really we have to think about pregnancy and the postpartum period and, helping people become healthy parents too. And it's not about perfection, it's about progress. And even if you're making those lifestyle changes so that your perhaps weight is dropping, you don't have to have the perfect BMI. It's the action of those lifestyle changes that matter. Dr. Bentov, I love that you value nutrition so much. I feel like a lot of REs ignore the fact that nutrition is that important for egg quality and sperm quality, and it should be number one, because we need a healthy soil to make babies.
Absolutely. Nutrition is the foundation of everything else. Everything else is on top of it.
We hope you found this interview as informative and insightful as we did. So please remember that this is not medical advice. You need to seek the help and discuss what you have learned with your physician so that you can make that informed choice. And next week, we're going to be talking about the impact of metformin in utero. So meaning if you're pregnant, what happens when you take metformin. So check that out, and we shall see you next time. If you have questions, concerns, please reach out to us. You can contact us at aliveholistichealthclinic.ca. We shall see you soon.